Good morning. This is Dr. Susan Marra and Juju with Dr. Marra's Medical Minutes. And today we're going to talk about the similarities between Lyme disease and COVID. You know, Lyme disease is caused by the bacteria known as a spirochete, also known as Borrelia burgdorferi. And COVID is caused by a virus, which is very different than a bacteria, generally by the SARS-CoV-2 virus. Now, both of those organisms can enter the cell and absolutely wreak havoc. And they do so by initiating the release of proinflammatory cytokines. In particular, things like interleukin 6, interleukin 8, interleukin 13. And it's believed that interleukin 11 is actually associated with the COVID-19 vaccine injury. But I think that still is, they're still trying to figure that out. But the release of pro-inflammatory cytokines causes a cytokine storm, which we saw during COVID, and renders people bedridden. And a lot of times the same thing happens in tick-borne illness. It depends on the patient, and absolutely there is a genetic piece to all of this. And what I mean by that is that there are some people who are genetically more prone to inflammation, and that can be determined by doing genetic testing. When you are prone to inflammation, I do believe you're at a greater risk for developing chronic illness. Elevated IL-6 is bad news. It's just bad news all the way around. It's bad news in tick-borne illness. It's bad news in COVID. And, a couple of the things that helps to lower it are curcumin, fish oil, and some people think quercetin, the bioflavanoid quercetin, helps to lower IL-6. I don't see that as much. I see more curcumin and fish oil do that, but I think when you have a cytokine storm, you also are likely to have MCAS, which is a exaggerated histamine response. And quercetin absolutely quells excess histamine. And it's very helpful for patients with MCAS. In addition to which, things like HistDAO, quercetin, bromelain, these all lower histamine, and they do so without causing Alzheimer's disease like Benadryl. Long-term Benadryl use can cause Alzheimer's disease, which is not something that you want. So natural remedies like quercetin, HistDAO, bromelain, and other flavonoids like luteolin and rutin are really great for lowering inflammation and the pro-inflammatory cytokine storm. So what we see in tick-borne illness and COVID is this unchecked inflammation that causes damage to your tissues and your organs. So one of the most important things to do for Lyme disease and COVID is to get your inflammation under control. And that means, diet, excellent sleep, lots of water, lots of love from your beings that live with you. And when you get your inflammation under control, generally people do feel better. So I hope this information has helped you, and I hope you have a wonderful day.